Welcome to InTouch Pharmaceuticals, located in Valparaiso, Indiana. InTouch opened its doors in 2004 with a staff of 6. In 2012, we moved into our current facility, encompassing over 17,000 square feet, now with staff approaching 150. InTouch Pharmaceuticals provides pharmaceuticals and pharmaceutical services to over 60 facilities that serve roughly 7,000 residents in Indiana and Michigan, with expansion to surrounding states on the horizon. InTouch Pharmaceuticals is a long-term care pharmacy. Unlike retail pharmacies, we do not service walk-in clientele for their prescription needs. We have an extremely secure facility. All employees use a badge for entry and access. The badges allow the employees a specific level of access to certain areas. We also have 24-hour surveillance through our camera system, keeping both information and employees safe and secure. Visitors sign in at the front reception lobby. The first area we will see is our training room. This room has AV adaptable flat screen monitors for PowerPoint presentations and webinars. This room is also set up for internal and customer meetings. Our pharmacy consultants meet here monthly, and this room also houses the weekly stakeholder meeting. On this side of the building, you'll see some of our administrative staff. This is one of our team members who is responsible for medications that are reportable to the DEA. She works closely with the Director of Pharmacy and makes sure that we have physician-signed prescriptions on file, so that InTouch and our partners are in compliance with all of the requirements for controlled substances. Here we have a full in-house IT staff available to assist our customers with all of their technology needs. Having in-house IT staff means we don't have to rely on an outside firm for customer support. This decreases the time it takes to respond to issues. In addition, our developers produce detailed reports, build and implement interfaces, customize electronic medical record requests, and work with a host of healthcare software vendors. Here are our medical record specialists. We can handle all of your medical record needs if you are not doing them internally. The team will work with you from the beginning of the go-live process, designing your medical records and continuing to work with you on a monthly basis to maintain accurate and complete records. Here is the billing area. We understand the hurdles families may encounter when dealing with insurance plans. Our billing specialists are available to guide them step by step through a sometimes confusing process to optimize Medicare Part D plans, Medicaid, and third-party coverage in order to maximize cost savings for both the families and your facility. This department truly goes the extra mile for each resident, spending countless hours to assure every claim and prior authorization is handled correctly. Next, we will see the server room. One of the many technological benefits at InTouch is dual site redundancy. If any of our equipment were to fail at one location, we have a secondary site on which we can fall back. This gives us immediate access to all of our residents' data. We lose nothing and we are never down. We have battery backup that holds us over until our generators can start up. Our generators, designed for our building, ensure that no matter how long the power is out, we can effectively service your facility without any delay. This is a proven system. In the past, we have had more than 6 hours where we've been without power, and yet we still are easily able to get the meds on time because of this redundancy. This is the data area, which is the start of InTouch Pharmaceuticals' workflow. We are a paperless facility, which means we can receive orders in 3 different ways. A facility can either fax the order, digitally transmit through electronic medical records, or we can receive orders from a physician's office. All orders are dropped into a queue designated for that particular facility. All of our technicians and pharmacists work off of this dual screen. The left-hand screen is our docu management system, designed by our software team. Here you will see the digitized order. Each facility has a daily queue cutoff time for orders. The right-hand screen is our pharmacy software system. Our software team has worked with both of these programs to ensure an accurate and complete interface and integration of data. Our goal is to complete all the orders in the daily queue so the orders can be put in totes that same evening for delivery. We understand that admits can happen at any time of the day, so if a situation occurs after a cutoff time, contact us immediately and we will make every effort to include that resident's medications with the delivery. This is our pharmacist's data area. Our pharmacists work both in data as well as dispensing. Here they verify all prescriptions for the correct directions, the SIG, prior to the order moving into the dispensing department. If necessary, they will contact physicians or the facilities to make sure there are not any contraindications, such as allergies or duplicate therapies. They work closely with your medical director, consultants, and your formulary. This helps to provide the best care and lowest costs for your residents while not compromising therapeutic outcomes. The dispensing area is 8,700 square feet of complete pharmacy. To our left is the inventory area, and to our right you can see our ATP machines. Each ATP contains the same formulary of 384 medications. We can run medications for any facility off of any machine in the event that something happened to a single machine. We are never in the position that we couldn't run a cycle and fulfill your medication promptly. The canisters that contain the pills are calibrated specifically for that pill. The medication that comes out of the machine will have the resident's name, the time which it needs to be taken, the date that it needs to be taken, and then all of the information on the medication itself. This unit dose packaging is checked several times at the pharmacy before it gets to the facility. And then the nurse that administers the medication can check the printed information against the order, the MAR, for accuracy. Once the product actually comes out of the machine, it is checked again. After all, it is still a machine. Our staff checks to make sure the pouch has the correct number of doses, there isn't any crushed medication, and the description of the medication matches. After the strip is verified, it is then rolled into what we refer to as a cycle. Once the cycles are separated and checked, a technician scans it. This tells the technician exactly where the cycle goes, including which facility, which unit, and the floor, very similar to a hospital. This can be customized to fit any facility's needs. One of the innovations we're working on is the RX Safe. The RX Safe will allow us to dispense medication even faster while increasing the overall safety and accuracy because there's only one bottle out at a time. The technician inputs a script and then the robotic arm will select the product, verify it with barcodes, then present it to the technician. After the technician has packaged the medication, the bottle is scanned again, placed back into the RX Safe where the bottle is weighed, which verifies that the correct number of pills have been removed and dispensed. If the order required 30 pills and the technician took out only 28 pills, the RX Safe would stop. It would not accept the bottle of medication and would prompt for a supervisor verification. The pharmacist would then double-check the discrepancy. The RX Safe is intended to avoid diversion and allows us to have perpetual inventory. This is important in keeping exactly the volume of medication needed on hand to service our facilities effectively. This is our bulk area, which uses the same handheld scanners and software you saw earlier. Bulk items are scanned, correctly labeled, and put into the correct routing bin. These bins then are moved to the pharmacist review station to make sure the correct medication is going to the correct resident with the correct instructions. Our final review station is again designed for the pharmacist to review every product that is going out the door. They are also managing workflow. By working on the dual screens, they know what delivery routes are going out at what time. The pharmacist can then adjust workflow so that everything gets to your facility on time. This is our Pyxis department. At one time, it was called our EDK, Emergency Drug Kit. It is common for the emergency drug kits to look similar to the fishing tackle boxes, similar to this. A typical EDK might hold 150 medications. In a facility environment, you would have to pull 2 nurses off the floor to take the medication out. It's a manual process filling out the forms and faxing. The new improved version of what we call an emergency drug kit is our Pyxis Specialty Station. What you're seeing here is a Pyxis used as our filling station, which is very similar to what you might see at a facility. We currently have over 40 facilities that are utilizing Pyxis and have been told by the Pyxis manufacturer, we are the experts in Pyxis implementation in long-term care facilities. Each morning, we run a report that tells us exactly what was taken from each facility's Pyxis. The report tells us what medications have been used, by whom, and what needs to be replaced within the past 24 hours. This QB is a self-contained, secure box that holds individual medications. At the facility, the nurse accesses the device with his or her bio ID, picks the resident's information, the correct medication, then only that specific drawer will open, and only that specific QB pops up to allow access. We feel the QB is a vital piece to the Pyxis station because the nurse is only being exposed to the specific medication that is needed, and not to an open drawer of multiple medications, which might lead to the possibility of medication error and/or diversion. After running the morning report, we replenish QBs that arrive in special color-specific totes with the nightly delivery. The QBs are then returned to the facility and then replaced in the facility's Pyxis by scanning the barcode, which opens a specific drawer and pops out a specific QB. The QB is then switched out and the old one returned to the pharmacy. Because QBs are self-contained and open only in the Pyxis, reports will show if there's any type of diversion or missing medication, or if incorrect medication was taken out. Everything is automated. After all medications are reviewed, they end up over here in our delivery department. The delivery department uses the same scanners you saw earlier. The technician scans the product and the tote, yet another step to ensure the correct medications are delivered to your facility. If a wrong tote is scanned, the technician will be alerted. At the end of the shift, it's time to close the totes. The technicians actually close the totes with the paperwork, seal everything, and then they're set for delivery by the drivers. InTouch Deliveries and its fleet of vehicles is actually owned by InTouch Pharmaceuticals. All of our drivers are employees of InTouch. This allows us to accommodate stat deliveries and still assure routes are delivered on time. Our drivers not only get the product from point A to point B, but we also believe that they are part of the customer service with your facility. Many of our drivers have been with the company since its inception. From the beginning, our drivers have been the eyes and ears of InTouch. We handle most of our own compounding here. Additionally, we use a local compounding company should there be something that is unique. Here is our IV room. We have both pharmacists and technicians that are specific to this department. The pharmacists who rotate through the IV department have over 50 years of IV experience in both hospital and long-term care settings. We have 2 hoods and are averaging about 50 IVs daily. Additionally, we compound and regulate TPNs. The pharmacist will dose antibiotics, most commonly aminoglycosides, gentamicin, tobramycin, amikacin, and vancomycin. We maintain a chart on every resident as part of our workflow. For each patient, we have a system of double checks, including a medication record and a compounding sheet. Once we pass through the computer, the technician tallies what she needs to make and goes into the USP 797 certified clean room. In the IV room compounding area, we are combining 2 or more sterile products. We need to add them together and maintain that sterility. This clean room is set to the United States Pharmacopoeia Chapter 797 standard of airflow and particulate matter count. Every 6 months, these hoods are recertified by an outside, independent contractor to maintain these standards. The clean room in which the hoods are located is sometimes called the buffer zone. This area maintains the highest pressure. Here you will see the pressure gauges that show pressure in the clean room and the anteroom. This one shows the pressure from the anteroom to this general area and the rest of the pharmacy. This is how we maintain a sterile workspace. Once the product is made and the technician has labeled and signed, the pharmacist comes by and does the double check. The Eclipse is an elastomeric all-in-one contained IV unit. This size infuses at a constant 100 mL per hour. The tubing is also attached, so it does not need a pump or pole. The nurses love this system because there's so much less nursing time, and it's very easy for the patients, who can stick it in their pocket and still go down to dinner or lunch. We use the elastomeric whenever we can. However, shorter expiration drugs are put in a mini bag plus system with the vial attached. The nurses would then break the seal and activate it by reconstituting the powder. We also dispense some antibiotics in premix form, and then if we need to, we will compound them straight into the bag. We have hydrations and do TPNs. All of our TPNs have been pharmacy to monitoring regulate. Once we have that order for pharmacy to monitoring regulate, it gives us the legality to order the labs and adjust the electrolytes from lab results. We work closely with the facility's dietitian in making sure that the patient's macronutrient needs are met.